Hello, good morning. I've got a case that I wanted to share with you. This is actually a 27-year-old woman I'm seeing in follow-up today. She, interestingly, was a patient of mine about a year and a half ago. She presented with acute left leg sciatic leg pain. Here's a quick shift over to her pictures from back in 2018. You can see that this is the L4-5. She's a little bulging up there, but then she got this large herniation down at the L5S1 level. So watch my video on reading your MRI scan. Remember, this is the spinal canal right here. These little dots are the nerve roots. And this is kind of a normal looking space at the 4-5 level. There's some mild bulging on the left side, mild compression over there. But when I saw her, she had this massive herniation down here. This is huge herniation, compressing, really crushing that left S1 nerve root. She had some searing left leg pain, ultimately ended up undergoing a microdiscectomy. So when I saw her on my schedule today, I was a little concerned and disturbed. I'm like, oh no, what happened? Well, today she's complaining of primarily left leg pain that started after she was involved in a hit-and-run car accident. Interestingly, she's not having a lot of back pain, so that's a good thing. Sometimes after that big of a herniation, patients will kind of lose the cushioning at that segment in the spine and can go on, even in a young patient like this, can go on to develop disc-related back pain from that segment. And then a jolt or a disruption like a car accident or something can kind of kick them down into a degenerative cascade where it's really hurting and we can't just stop it. So that was my first concern, is that she's got a lot of back pain and that disc is starting to fire up. Interestingly, she's not having that problem. Her problem today is that she's actually had worsening of a herniation at the level above her surgery. So here is the new MRI, and just for reference and review, so this is the 5-1 level. You can see that that big black herniation is now gone. There's some scar tissue around the nerve, which is typical, but our laminectomy is this site right here. That area of access was only about, let's see what that is, 5.6 millimeters. So we worked through a pretty small window to get there. But there's no residual herniation. You can tell that that disc has collapsed some more at that segment, and that's because the cushioning's gone. What's interesting, though, is compared to her prior MRI scan, now at the L4-5 level, maybe due to this car accident or something else, she's developed some new herniation or worsening herniation that's causing left leg pain. So I thought this was a pertinent example, something helpful, interesting to me at least, might be interesting to you, about what can happen after a herniation and a discectomy. You can, in a small subset of patients, develop chronic disc-related back pain. Not everybody gets it after a microdiscectomy. Some people do. Unfortunately for this patient, or fortunately, she's not having discogenic pain at the 5-1 level where her herniation was. She's having a new herniation at another level. Now, her question for me is, hey, what am I doing wrong that's causing me to have all these herniations? I said, are you doing any deadlifting or heavy lifting or CrossFit? She's not. She works a desk job. I think she could be working and doing more to keep her core strong. Little prognosis for this patient today. She's already started PT, done 2 weeks. She's already getting some improvement in her symptoms. I recommended she continue anti-inflammatory medication, and we're going to follow up in about 2 more months.